Good afternoon. I'm Lorraine, and I'll be the Excelsior nurse for the day. And we have an order for Lasix for a patient due to fluid retention, and they need to get this Lasix furosemide for greater than 3 pound weight gain. So I'm going to check my MAR with my medication, make sure we have the right patient, we're given the right meds, the right dose. So we have a medication for Renee Adams, and her date of birth is 5/25/78, and she has no known allergies. I have my supplies. Miss Renee has her armband. I have my medication vial. I have my saline flush, my needle to pull up my medication, my alcohol pad, my hand sanitizer, and my patient's arm for my IV push. I'm going to check the expiration date of my medication, and it is February of 2026. Performing my hand hygiene. I've washed my hands. So then I have my supplies for my IV push, my flush, my needle, my vial, hand sanitizer. So we have an order for furosemide injection, 10 milligrams per milliliters, 20 milligrams IV push every 12 hours as needed from weight gain greater than 3 pounds to be administered over 2 minutes. And we have to flush with 3 mLs of normal saline before and after we inject the medication. I've drawn up 2 mLs of Lasix or furosemide. I'm going to go ahead and knock on the door. Knock, knock. My name is Lorraine. I'll be your Excelsior student nurse for the day. And we are going to, your doctor has ordered furosemide because you have fluid retention and you've gained more than 3 pounds. I'm going to provide you with some privacy. Again, I'm going to perform hand hygiene again. And I'm going to identify your name with your armband. You are, in fact, Renee Adams. Your date of birth is 5/25/78. And I'm going to put my clothes on. And Miss Renee has no known allergies as indicated on the MAR. I'm going to assess the patient for any infiltration, any liquid or coolness under her insertion site for her IV. There's no warmth, redness, swelling. We're going to clean our port with alcohol and allow it to dry for 15 seconds. So 15 seconds has passed, and we're going to connect our saline flush to our IV site. We are going to gently flush with 3 mLs of normal saline. I'm gonna unlock, and we're gonna clean it again. Of course, this would be a brand new alcohol pad, and we're gonna let it dry for 15 minutes. All right, we're going to I've already drawn up my 2 milliliters of Lasix. Before that, I did push out any air out of it and then fill it up. I'm going to go ahead and administer my 2 mLs of furosemide. I'm going to, of course, I remove the syringe and put it in my sharps container. And I'm going to clean the site again with normal saline. I'm not normal saline. Back up a little bit. I did forget to ask Miss Renee to tell me her name and date of birth. Her name's Renee Adams. Her date of birth is 5/25/78. Do you have any known allergies? No, she doesn't. And I have flushed. I'm going to flush again. Breathe. So cool. I'm going to reassess her site for any infiltration or inflammation. There's no wetness around the site. There's no warmth, redness, or swelling. I'm going to remove my gloves. Make sure that the patient's call light is within reach. I'm going to go ahead and document the medication I've given. Furosemide, and she received 2 ml IV push. It is now 3:58, and she did receive 3 mLs of normal saline before, after. And I have washed my hands. And I'm just going to go ahead and reiterate to Miss Renee, your call light is within reach. Please hit your button if you have any changes in condition, if you notice any redness, swelling, warmth at the IV side, if you see any fluid that's leaking out or your arm feels cool. And I'm going to go ahead and close your door.